Now, simple medical conditions becoming much worse because of the COVID-19 pandemic. Administrators at the Mandeville Regional Hospital in Manchester say it's why they do not want to suspend elective surgeries. But as COVID cases continue to skyrocket, they say in another 2 weeks, they may not have a choice. Krista Campbell has the details.
COVID patients on the male, female and maternity wards of the Mandeville Regional Hospital in Manchester as cases continue to climb, pushing the medical facility close to the brink of another bed shortage. The hospital has a capacity of 226, but up to the weekend, 229 patients were admitted. During a tour on the weekend, CEO Alwyn Miller told Health Minister Dr. Christopher Tufton that the hospital has not been able to set up another isolation ward in the pediatric department as it did in the last COVID wave because more children have been admitted with seasonal illnesses.
We have had children who are sicklers, asthmatics, and some with viral respiratory illnesses who have presented.
And as COVID admissions continue to rise, he says the hospital is approaching emergency mode. When that happens, elective surgeries and other non-emergency services will have to be suspended. But it's a decision Senior Medical Officer Dr. Everton McIntosh says he doesn't want to take.
We don't really have the direct figures, but anecdotally we know that there is a significant increase in terms of the numbers of persons coming in for emergency surgeries related to some conditions which could have been done electively. So we talked about hernias, for example, where persons will come in with a hernia. Now, the term we use is either incarcerated or perforated, because now a major procedure instead of the simple surgery that would have been done if it was done electively. So persons who are having like cataracts, who need their cataract surgeries for them to restore their sight, have had to be enduring loss of sight for a protracted period, so going back almost 2 years, and some of them would have gone completely blind in the interim.
But the hospital is not at that stage just yet. So for now, administrators continue to monitor the daily COVID admissions and make adjustments. On the male and female medical wards, a few modifications.
This is the original door, and we have put in this feature. We have put in a feature around the nurses' station, etc. To protect them and to create a clean zone for the staff to work in. So the proposal is to put those non-COVID patients, the patients with the non-communicable diseases, over by the outpatient department, which we have done some modification to. Right? And if you recall, we had moved the clinics over to the church to create that space.
Krista Campbell, TVJ News.